Hello and welcome. Today, we're delving into a condition that affects the male reproductive system, testicular atrophy. We'll explore what it is, what causes it, how it's diagnosed, and what can be done about it. Testicular atrophy is, simply put, the shrinking of the testicles. It's a condition that can impact hormone production, sperm production, and overall sexual health. So, what causes the testicles to shrink? The causes of testicular atrophy are quite varied. One common cause is aging, as testicular size can naturally decrease over time. However, several other factors can play a significant role. These include hormonal imbalances, such as low testosterone or high estrogen levels, certain medical conditions like varicocele, which are enlarged veins in the scrotum, and orchitis, an inflammation of the testicle usually caused by viral or bacterial infections, can also lead to atrophy. Trauma or injury to the testicles, and even the use of anabolic steroids, can disrupt the normal function and cause the testicles to shrink. In some cases, testicular atrophy can be caused by undescended testicles, also known as cryptorchidism, if not corrected in childhood. Finally, certain medications and exposure to radiation or chemotherapy can also contribute to testicular atrophy. Now let's look at what's happening on a biological level. The pathophysiology of testicular atrophy revolves around the disruption of normal testicular function. The testicles are responsible for producing testosterone and sperm. When the testicles are damaged or exposed to unfavorable conditions, the specialized cells within the testicles, known as Leydig cells, which produce testosterone, and Sertoli cells, which support sperm production, can become impaired. This impairment leads to a decrease in the production of these crucial hormones and sperm. The reduction in cellular activity, coupled with possible cell death or shrinkage, results in the overall reduction in testicular size and can compromise their functional capabilities. The extent of atrophy correlates with the severity and duration of the underlying cause. Understanding how common testicular atrophy is can be tricky, as it often goes unreported or undiagnosed. Its prevalence is closely tied to the prevalence of its underlying causes. For example, conditions like varicocele are relatively common in men, and orchitis outbreaks can occur during mumps epidemics. Anabolic steroid use, though generally underreported, is a significant factor in certain populations. The age of onset can vary widely depending on the cause, from childhood in cases of uncorrected cryptorchidism to later in life due to aging or other medical conditions. While there isn't a specific demographic that's immune, men with risk factors like a history of testicular injury, hormonal imbalances, or certain medical conditions are at higher risk. The most obvious symptom of testicular atrophy is, of course, a noticeable shrinking of one or both testicles. However, other symptoms can also occur, and they often depend on the underlying cause. These can include decreased libido or sex drive, erectile dysfunction, infertility, a reduction in muscle mass, fatigue, and breast enlargement, also known as gynecomastia. Some men may also experience pain or discomfort in the testicles, especially if the atrophy is caused by inflammation or injury. It's important to note that these symptoms can also be indicative of other conditions, so it's crucial to seek medical evaluation for proper diagnosis. Diagnosing testicular atrophy typically begins with a physical examination by a doctor. The doctor will examine the size and consistency of the testicles. The next step usually involves a medical history review to identify any potential causes, such as past injuries, infections, or medication use. Blood tests are often ordered to check hormone levels, including testosterone, luteinizing hormone LH, and follicle-stimulating hormone FSH. If further evaluation is needed, an ultrasound of the scrotum can provide detailed images of the testicles and surrounding structures, helping to rule out other conditions such as tumors or varicoceles. In rare cases, a testicular biopsy might be necessary to examine the testicular tissue more closely. While testicular atrophy isn't typically classified into distinct types, it can be broadly categorized based on the underlying cause. We can differentiate between atrophy caused by hormonal factors, infectious causes, traumatic causes, or medication-induced causes. Furthermore, the condition can be classified by its severity, ranging from mild atrophy, where only a slight reduction in size is observed, to severe atrophy, where there is significant shrinkage and functional impairment. Understanding the underlying cause is crucial for effective management and treatment. The treatment for testicular atrophy depends entirely on the underlying cause. If it's due to a hormonal imbalance, hormone replacement therapy, such as testosterone injections or gels, may be prescribed to restore normal hormone levels. If a varicocele is the culprit, surgical repair or embolization may be recommended to improve blood flow. In cases of infection, antibiotics or antiviral medications can be used to treat the underlying infection. If anabolic steroid use is the cause, cessation of steroid use is crucial. and supportive therapies may be needed to help the body recover. For undescended testicles, surgery is often required to bring the testicles down into the scrotum, ideally performed during childhood. In some cases, if the atrophy is severe and causing significant symptoms, surgery to remove the affected testicles or orchiectomy might be considered. While not all cases of testicular atrophy are preventable, there are steps you can take to reduce your risk. Practicing safe sex can help prevent infections that can lead to orchitis. Avoiding anabolic steroid use is crucial, as these drugs can significantly disrupt hormone balance and damage the testicles. Wearing protective gear during sports and activities that could lead to testicular injury can help prevent trauma. Regular self-exams of the testicles can help detect any abnormalities early. Ensuring that children with undescended testicles receive appropriate medical attention is also important. Consulting with a healthcare professional about the potential side effects of medications can also help prevent medication-induced testicular atrophy. The prognosis for testicular atrophy varies depending on the underlying cause and the extent of the damage. In some cases, if the underlying cause is treated promptly and effectively, testicular function can be partially or even fully restored. However, in other cases, the damage may be irreversible, leading to permanent infertility or hormonal deficiencies. Recent research is focusing on developing new therapies to protect and restore testicular function. This includes investigating the use of stem cell therapy to regenerate damaged testicular tissue and exploring new medications to improve hormone production. Further research is needed to determine the long-term effectiveness of these emerging therapies. It is important to discuss your individual prognosis with your healthcare provider, as it can vary depending on your specific circumstances. Thank you for joining us today.